Good morning, everybody. My name is Dr. Carol Jenkins Neal, and we are getting ready to start our webinar series. Today would be our very last series, Mass Incarceration, and we just would like to say thank you so much for joining us today. I would like to introduce you to our panelists, and we have with us Mr. Phil Caroon, and we also have Ms. Dr. Sydney McKinley. And I want to just give a little introduction because I know that all of you guys have read the bio of both of these individuals, but I just want to kind of like give you a little bit of information. And I'll start off with Dr. Sydney McKinley first. She's the Executive Director of the National Black Women Justice Initiative. She's deeply committed to advancing rigorous research, policy, and assistance with lifting up the voices of system-impacted Black women, girls, and gender non-conforming people. Under her leadership, her organization is responsible for lots of different types of research and advocacy to demonstrate the importance of centering the experience of Black women, girls, and gender of non-conforming people in efforts to end mass incarceration. She has over 15 years of experience in the areas of child welfare, as well as justice reform and leading research. And I just want to say thank you for joining us today, Dr. McKinley. Dr. McKinley has a partner that's also a director of research and advocacy, also with the National Black Women Justice Initiative. And this is Dr. Janae Love. She's an activist, she's a researcher, she's a licensed master social worker, and she is into the research as far as criminal legal reform, youth justice, and child welfare. She has an extensive knowledge and experience designing, implementing, and analyzing different types of research. We also have with us today, we have Mr. Phil Caroon, Esquire. The Honorable Phil Caroon has served as a Maryland trial judge for over 17 years with prior experience as a prosecutor, defense attorney, and general practitioner. As you can see, he has been very active with the correctional system. He sought to reform, and he did an internal judiciary committee to address sentencing. Thank you for that, Mr. Phil Caroon, and we really appreciate that part for sure. As he approached retirement, he decided to work with several groups and leaders to advocate to establish this organization. The Maryland Alliance for Justice Reform is a statewide, all-volunteer, bipartisan group seeking to reduce incarceration and promote less costly, more effective alternatives. He is doing something to make a change with our incarceration system. With the team of the Ad Hoc Committee of Population Health, we have Dr. Joan Smith, and Dr. Joan Smith has served over 15 years in the nursing profession as a nurse practitioner. She's very passionate about health promotion, disease prevention, especially in marginalized communities. She's very active from a local, state, and national and international levels, and her primary focus is public service. She has been a champion as far as teaching about health equity. I also have with us Dr. Pierre Brodnix is a member of the team. She has over 40 years of experience in professional nursing as a direct provider, educator, mentor, and administrator. She has advocated for a vulnerable population. She's a well sought after speaker from a local and national level. She does research projects locally and internationally. She's very, very much involved with research. She serves in today's environment as far as developing partnerships, which I think is very important. Dr. Brodness has had so many leadership roles in health policy, as well as health disparity with many different organizations. I could go on and on and on. Dr. Brodnix has also served as a director of correctional facilities that included 7 prisons, also a treatment center as well, and also the juvenile detention center. I am your host, Dr. Carol Neal. I'm the chair of the Population Health Committee. So thank you so much for spending time with us for this hour as we end our series on health reform, prison population, and mass incarceration. I want to start off with Dr. Sidney and then I want to go to Mr. Phil Caroon. And I just want both of you guys to kind of give an introduction to talk to us about your organizations before I have questions and before we have questions from the audience, because usually we like to make this very interactive. So Dr. McKinley, could you give us information about your organization, the National Black Women Justice Initiative?
Well, thank you so much, Dr. Neal. I am so happy to be here today. As she mentioned, I am Sydney McKinney. I am the Executive Director of the National Black Women's Justice Institute. We call it NBWJI for short because it is a mouthful, but we are doing really important work. We are focused on trying to end the systemic criminalization and punishment of Black women and girls. So we are really focused on using research, evidence-informed policy, and advocacy to enact systems changes that really mitigate and eliminate the punitive paradigm that really is the foundation of our criminal legal system, of our penal system, and really replace it with opportunities for healing, because so many of the people who are directly impacted by incarceration, particularly women, are survivors. They're survivors of myriad forms of trauma. And so we really recognize and understand that prisons as they exist now were never set up to really respond to the factors that lead many people to come into contact with these systems. And we really shouldn't be criminalizing people who are survivors of different forms of trauma and harm.
Thank you.
That is our work.
Thank you so much. And Mr. Phil Caroon, could you please tell us about your organization? Could you give us some insight? Because we have people on this call that have maybe never heard about your organization.
So our group is a state level group focused on the state of Maryland, Maryland Alliance for Justice Reform, and our acronym is MAJOR. This is a group that started from a book reading club, a Quaker meeting that I attend with another church, read Michelle Alexander's The New Jim Crow, Mass Incarceration in an Age of Colorblindness. And if folks have read that book, the last chapter, Ms. Alexander says, so what are you going to do about it, in effect? And our book reading club said, well, maybe we could pass a bill. Having me in the group as someone who had studied this issue through the court system, I suggested that we try and get the group to support the concept of justice reinvestment, which had started with both the George W. Bush and Obama administrations, the concept being to shrink the prisons and use the money that you otherwise would have been using to operate the prisons for alternatives, to have more drug treatment, more mental health treatment, and so forth, more prevention. And through that to hopefully shrink the prisons sizes further still. It took us 2 years, but we got that bill passed in Maryland, which created a Justice Reinvestment Fund and Oversight Board. However, that being 2015, in the subsequent 5 or 7 years, the prisons have only shrunk about 15%. And we would like to see it shrink further still. So we're now focusing on individual initiatives at the different parts of the system. On the prevention end, which we call the front door, behind the walls to make the prisons actually rehabilitate better and reduce recidivism, so people will need to come back. And on the back end, for returning citizens to try and make things easier for them to reintegrate in the community and again, not recidivate, not have new troubles that will bring them back again. Our group is composed of a complete spectrum. They're professionals and retired professionals like myself. There are returning citizens and their families. There are folks who have been in the correction system. And so we try and get all those points of view and get the advantage of the experience from each group as we design our initiatives and try and bring them forward to the legislature 1 year at a time.
Thank you so much. Based on everything you say, I guess my very first question would go for you. And Dr. McKinley, I'd really like for you to listen to this because I want you to answer this too, but I want to go to him because he's a retired judge with this particular question. So why do you think the United States has the highest incarceration rate?
I personally believe that it connects to the war on drugs and the war on crime that were created initially in the Nixon administration and then amped up in the Reagan administration. They simultaneously created more offenses for drug use and also increased the penalties and also took away judges' discretion by making mandatory penalties and enhanced penalties. Those are all things that, you know, created an upward trend. Another thing that I think might be unique in the United States, but I'm not 100% sure, is the fact that 95% of all our cases are dealt with through plea bargains. The prosecutors have such a strong hand as a result of pretrial incarceration and all the advantages of the system that they are able to make people plead guilty, in effect, in 95% of the cases.
That's really bad. 95% are doing a plea bargain, saying they did something they really didn't do just so that they can get a lighter sentence.
I'm not going to say 95% are saying something they didn't do, but there is a significant percent who, whether they did it or not, but 95% will not even try to go to court because they know that the disadvantages are so great that it might be even worse if they went to court. And again, I don't know that in all the other parts of the world that we had those series of factors stacked which favor more incarceration as much as we have in the United States.
I have a quick follow-up question, Dr. McKinley. Do you, with these people that are pleading, do you have a percentage of how many people you think are really innocent that went to prison? Do you have any data on that, perhaps? Or is anybody doing any research on that?
I can make one comment, which is there's a study that I've seen about the frequency of confessions, which turn out to be false, misleading confessions. And this is a study out of California, which suggests that it happens with juveniles 3 times as often as it happens with adults. And that's an interesting statistic in that, you know, the reason that we have to think that children are more likely is because, you know, we train them as children to respect authority and to cooperate with adults. And if the adult is saying, in effect, isn't this what happened? If you say that this is, you know, the thing that happened, then things will go better for you. They, you know, encourage that confession, whether it's accurate, true or not.
Thank you.
And so again, 3 times more frequently than adults says something about our system.
It does. Thank you so much. Dr. McKinley, the same question for you. Why does the United States have the highest incarceration rate? What are your views on that?
Well, I think I agree with so much of what Mr. Karoum shared about the reasons why the United States has a much higher incarceration rate than other countries. I think I would add, though, that I think there are a few things that are really unique about our carceral system. I think that in our country, we tend to not view people who commit crimes or who are arrested or convicted as crimes as people who have the capacity to change. And so I think if you look at the way our prison system is set up compared to other countries, you'll see that it is far more punitive. And I think that's another reason why we have a lot more people who are facing extreme sentences, so are just staying in prison for a very long time. I would also add around the point about plea bargaining. I think we also have to remember that so many of the people who are impacted by our carceral system are Black. And we live in a country where Black people don't feel like they're going to get a fair shot at a trial and may be concerned that the sentence that they receive as a result of going through the court process may be more severe than what is being offered to them as a through the plea bargaining process, because often plea bargains are supposed to be in less than what the kind of top range of what the sentencing could be. So I think those are other things for us to consider about what makes our incarceration rates different.
I agree, because just think about it, everyone. If they're saying, okay, if you accept this plea, you might just get 5 years and you're out. If we take this to trial, then you might end up with 30 or 40 years or something like that. So they're admitting to something they really didn't do, but that's sad. And I think it's really sad that most of the children, the juvenile, they are the ones that are doing this 85% of the time, which is really sad. So my next question, and the question pretty much is would be for both of you guys, and I'll start with you, Dr. McKinley. With prison construction as an industry and prisons as large employers, do you think the economic forces exaggerate our incarceration levels?
Definitely. I mean, prisons are businesses, right? And so in order for prison, and we have this expansion of private prisons as well, right? So I think there is a kind of perverse incentive to fill prisons with people because these are jobs, and they're often placed in communities where many people within the community are working at that prison. So I do think that there's this perverse incentive around incarceration that is related to the economics of it being a business. And we also know that for people who are incarcerated, they are engaged in labor that they are not adequately compensated for, right? So prisons are a business. There is this incentive to keep them filled.
Thank you. Mr. Karoum, what's your viewpoint on that?
Sadly, I don't 100% agree for the state of Maryland in the sense that we don't have private prisons operated in our state. We do have a few private contractors, like the medical contractor for state prisons is a private organization. There used to be a private organization running a DUI rehabilitation facility in Prince George's, but other than that, it's all state operated. And I think that when the prison population was on the upswing, local politicians in underdeveloped rural counties would ask for a prison to go there because it would employ people. But I'm not sure that that is what is driving it at this time. Right now, there is underemployment in our state prisons where they need to hire more correctional officers and they can't get people to take those jobs. They need to hire more psychologists and drug treatment counselors in the prisons. They can't get people to take the jobs. So it's not like employment is driving this right now. So I'll just stop there in terms of the private employment aspect. I think there are problems with the whole model, as Ms. McKinney said, of incarceration per se as supposedly going to rehabilitate and people and solve the problem. We know based on lots of evidence-based studies that that doesn't work, that the things that do work, like education and employment and better social networks, those are not at all being supplied by the prisons. The opposite is true.
And that was my follow-up question, was rehabilitation. Okay, you served 10 years of your life in prison. What are they doing in the prison system so that when those people leave, they can at least be able to find a job, they can be able to interact with their families. They missed out on so much: weddings, funerals, birthday parties. They've missed out on so much. So what are they doing? Because each person in prison, and I have this question personally, does each person in prison have advisor or a social worker or someone that's working with them individually to make sure they are mentally stable when they are released? And this question is for either of you guys.
So I would be happy to answer for Maryland, and maybe Ms. McKinney can respond for the country at large. In Maryland, there is a case worker for every maybe 100 prisoners who would talk with them about their options, but talking about their options and saying this is what you need to look for isn't the same thing as providing those services. The number of prisoners in Maryland who are able to get employment other than pushing a broom or cleaning up the cafeteria, to get employment training that will actually help them get a job on the outside, is about 1 in 10, a little bit less than 1 in 10. The Maryland Correctional Enterprises, that employment organization, does a great job for those 10% or slightly less than 10% that they help. Those people have a very low recidivism rate because they have an employable skill when they get out. But why we're not able to offer such training and such employment experience to the remaining 90% does not make good sense to me. The education is really almost as good or better. When a person gets a college degree during prison, their recidivism rate basically falls off the table. It goes from over 50% to maybe under 20%. But the number of folks getting degrees, getting GEDs even, in prisons in Maryland in the past 20 years has dropped. It hasn't gone up. It used to be that 1,000 people per year would get a GED, and in the past few years, it's down in the ballpark of 300. Should be moving the opposite direction. And so that is both of those things, but especially the education piece is something that our group is actively working on. Another thing that greatly drops recidivism is if you can help people make connections, reconnect with their family, make sure they have a place to stay, make sure they have a job prospect to go to immediately when they're released, they have a much better opportunity to succeed. The problem is, though, that those connections are very weak in Maryland. We've been asking for a network of reentry to connect the state prison to the localities that people will return to. And in concept, the state has agreed to that. In practice, they have not done it for the past 2 years, or only done it in limited circumstances, just a few counties.
Thank you.
24.
Thank you. Same question for you, Dr. McKinley.
So I am of the belief that prisons are not rehabilitative. They were never meant to be rehabilitative. They are meant to punish. And I think if we are to think about it, right, this system, we have capital punishment. We cannot have a system and believe that our penal system is meant to rehabilitate it if we actually think that there are people who cannot be rehabilitated. And so I think it's really important to just start there. And I think, as Mr. Karoun pointed out, there are so few programs and very little access. So prisons do have programs. People who are in prison may be able to participate, but the percentage of people who are incarcerated who are able to access those programs and services is so limited, right? That to me, this is another indicator that this isn't about rehabilitation. This is about punishment. If we were truly concerned about rehabilitation, as Mr. Karoun pointed out, there would be social workers, there would be education, there would be employment, there would be mental health, right? There would be really extensive health and wellness. None of those things exist in prison. Prisons are meant to punish. They actually cause trauma, right, that people are dealing with and live with post-incarceration. And so I think, I think we just have to let go of this idea of rehabilitation. This is just kind of language people are using to make themselves feel better about incarceration, but that was never the intent. And I think it's also really important to note that there are people that we have worked with incarcerated women who say, hey, I was released and I didn't know where to go. I had a meeting with someone just before I was released. They said, here are some things you should think about, try and get housing, try and reconnect, try and get a job. There was no support. And when they got out, they had no connections. And they called back into the prison to say, where are some programs and services in my community that I can access? Those are all things that, if this is meant to be rehabilitative, they get from day one. And so prisons are not meant to be rehabilitative. They are not really about the health and wellness of people. They are about punishing people, period. And if we really cared about healing and supporting people, we would change this model. This is a call full of nurses. So you are thinking about health interventions all the time. If we were to evaluate prisons by like a health intervention model, we would shut it down because it fails. The recidivism rates are astronomical, and that alone is like, this model does not work. So we have to think of something new. But that gets back to my point is prisons have existed for a very long time. No one is evaluating the impact of prisons based on the recidivism rate. And they exist and they continue to exist, and the access to services and programming continues to decline.
Thank you so much. Thank you. We have a question in the chat box. Ms. Danielle Landers, could you please open up your mic with your question, please?
Ma'am, thank you. Can you all hear me okay?
Yes.
Okay, I just wanted to ask a question just to kind of piggyback off of the things that you all have offered so far as when folks are not discharged, I'm sorry, when they're released, as far as their healthcare is concerned, I know that many times that people are not even diagnosed with serious chronic illnesses until they are incarcerated. So when they go back out into start their life over, they don't have connection to healthcare. They don't get their medications that they were receiving. They don't know how to get connected with a primary care doctor. Are there any I don't know if in Maryland or anywhere that anybody knows of like good programs, but they do have some systems set up in that.
If you don't mind, I'll jump in here.
Sure.
If we think that the correctional system is broken, think about the healthcare system. So if people who have not been incarcerated have difficulty accessing healthcare, what happens to those who are released into the community with chronic illnesses and try to get connected to healthcare systems? The system of public health care, as we have found out in our recent pandemics and in other pandemics, nationwide pandemics, is terribly broken. So in order to access systems, you have to have the A system in place. And so if we don't have a public health care system, and I emphasize the term care, how will people who are released to the public receive management for their chronic illnesses? What we can do in as nurses in correctional healthcare system is offer them education, how to self-manage your care, in hopes that when they are released, that they can be referred to a care provider in the community. But public systems are few and far between.
Thank you. I think Mr. Karoon was about to answer that question as well.
I was going to say that in terms of the reentry mechanism in Maryland, there are a few places where there is a good system. The Montgomery County Detention Center has a pre-release program where there is a transition, there are counselors, they help everyone, you know, on an individualized basis with their particular needs and risk assessment factors. But on a state level and in most counties, the best thing that they would have would be a probation agent who can hand them a few phone numbers after they're released. And in essence, the returning citizen is on their own. There are, however, in other counties, a lot of private organizations that help with transition, halfway houses, other reentry programs. But as someone just put in the chat box, there's not a warm handoff. We're trying to, with the reentry network that was discussed a couple years ago at the outset of the pandemic, with our state prison folks, we're trying to create that warm handoff, and it is just a real challenge because of the prison's limited resources to do that. In concept, our Maryland and US prisons are trying to rehabilitate people, are trying to reduce recidivism, but in practice, we are far behind the models that they have in Europe, where a lot of that is actually done. Prison sentences over there are shorter, the educational and health support is better, and the results are better. But we are far behind that because we're just not funding. We're not putting our money where the evidence-based strategies are.
Thank you. Go ahead, Dr. McKinney.
So I just wanted to add, I think it's a really important question. And one organization that we work with is called A New Way of Life. It is a gender responsive reentry program based out of California, led by Ms. Susan Burton. She is a formerly incarcerated woman herself. And they have, in the last couple of years, created among their suite of services for the women that they work with, a medical care coordinator position, because they saw of the women who were coming into their program after incarceration, many of them had chronic illnesses, they had difficulty getting access to their medication, they couldn't find a primary care or any kind of doctor or a gynecologist because these are formerly incarcerated women. And so they really saw that there was a need within their services to be able to provide that to the formerly incarcerated women they serve. But they're really unique. I think we're not investing in connecting formerly incarcerated people to primary care and medical care post-incarceration in the way that we need to. I'm not sure the status of this, but many years ago, the Department of Health and Mental Hygiene in New York City actually was starting a new program that was focused on connecting formerly incarcerated people to primary care providers. But we at the National Black Women's Justice Institute are actually in the process of doing a study with formerly incarcerated Black women about how they navigate the healthcare system and meet their wellness needs post-incarceration, because there's just an absence of this information in the literature. And if we're going to devise new interventions that are gender responsive and trauma informed for formerly incarcerated Black women, we need to understand what their experiences have been accessing medical care inside and post incarceration. And we don't have enough of that right now.
Thank you. I want to read some of the comments in the chat box. It's phenomenal. Dr. Hussein, women in society are losing status. What is being done in Maryland and nationwide to ensure women are safe? And I think, Dr. McKinley, you pretty much addressed that when you talk about your organization. It mostly focuses on women. And if I remember correctly, Mr. Karoun, did you talk about some of the different things they have for women in Maryland?
I haven't addressed that. When we're talking about women in the community being safe, that is an aspect that our organization has not actively pursued. I know there are, various women's nonprofit organizations in our community, but again, I'm shouldn't be trying to speak for them. In terms of the Maryland correctional system, there is a single institution when women are incarcerated, MCIW, the Correctional Institute for Women in Jessup, and it is not as well equipped as it should be. There recently was a bill that we and other advocates got passed to have a women's pre-release center that would be in Baltimore, which is where most of them would rather be released to. And there have been various steps to deal with women's particular concerns, but it is still under-resourced, and I don't know that the pre-release center is in operation yet. So we do have a good ways to go.
Yes, we do. And Ms. Donnell, I love your comment. She says, I imagine it is similar to when our veterans discharge from the military and have difficulties adjusting to civilian life and are not equipped by the government with adequate resources and ends up being homeless. And basically,
Worse than that, because there's no Veterans Administration for returning citizens.
Yes, that is really bad. So while, as Dr. McKinley would say, being in prison is a horrible thing, they're not trying to reform, they're not trying to rehab, they're not giving you any skills or anything. So basically, when you get out, you're pretty much on your own. And I think another person, I'm trying to see who it is, Ms. Donnell, could you please speak up, because you're talking about you worked in a correctional for 6 years and you've actually witnessed people who would commit another crime to get back in prison. Could you please talk about why?
Yeah, it's been some time, but I did work in correctional medicine, correctional nursing for 6 years, and it was almost like working in a nursing home is how I would liken it to be, because folks would come back, they get released, they'd come back and get released, and they would tell you their stories when they would get reincarcerated, and would share their stories that they were receiving their medications while they were incarcerated. They felt quote unquote regular as far as their mental health was concerned. When they were released, they wouldn't know how to get connected to health services. They'd stop receiving their medications. They wouldn't know how to get connected to services to be able to receive their medications or to see practitioners for even if they had chronic illness as well, physical illness. And they would commit low level. They would say, I knew what to do. If it was something like trespassing, which would be like finding shelter in a building downtown, and they would be reincarcerated for some low-level crime so that they could be reincarcerated and receive their medication. Literally, people would share that story over and over again. And it was just so sad. It should not be that way.
People definitely commit crimes when they're homeless in the wintertime to have shelter. I would just add a bill that our group is pursuing is to create a correctional ombudsman office. That would be an independent office, not part of the prison system, that receives complaints, does unannounced inspections, investigations, and would make recommendations on system-wide problems, as well as individual cases. We did a study comparing ombuds offices in the prisons in other states around the country, and the lack of medical attention, even within prison, was the top category of complaint. That was the single most frequent type of complaint in all prisons where they have independent oversight.
Well, thank you so much. Dr. McKinley, go for it.
Yeah, I would just add, though, I think that example really speaks to the drivers of incarceration for many people are outside. They're about survival, right? It's about how do you meet your needs? And I think we have to recognize that prison isn't the answer. We need to be creating more job opportunities before people become incarcerated. We need to connect people with education. We need to support people's basic needs. When people's basic needs are met, when they have the opportunities to thrive, we won't have an incarceration problem. This is a country that does like to incarcerate, particularly likes to incarcerate Black people. So I do think we would have some incarceration. But I think if we actually, to Mr. Karoom's point about justice reinvestment, and started investing in those systems that we know have protective effects, that we know connect people with families, that connect them with employment, right? That is how we shrink incarceration, is we actually have to start investing in our communities. And then you won't have stories like what Ms. Landers just shared of people actively and intentionally trying to be reincarcerated because the systems in their community are not able to support them, right? Those safety nets aren't real. And we actually have to build those up if we want to reduce incarceration.
Thank you. And that takes me to the statement by Karen. And she says, we need to advocate for change in our systems. We as nurses, we have a special voice to advocate for system change. And that is a pledge. And I really would like to open that up for discussion for anyone that could tell us, Dr. McKinley or Mr. Karoon, how could we as nurses, the National Black Nurses Association, what could we do to advocate for change? And if I have any nurses that would like to speak up to give an idea, please, anyone, what can we do as nurses?
I'd like to say one thing about that before hoping that other folks have lots of comments, which is since our group has in the past 7 years spent a lot of time in the legislature and committees listening to legislators' questions and eventually listening to them explain why they're going to vote for or against a bill. Whenever a legislator explains why they're voting for or against a bill, the single most common explanation is an anecdote. I heard this person explain that this happened to them and their family when thus and such occurred, or I have a constituent and this happened to my constituent. So that a very powerful form of testimony, at least from the legislator's point of view, as to why a change in the system is needed or a new rule is needed, is for people to come in and give examples. I have patients and this has happened to them and I've seen it, a lot of times, or this happened to my child or my uncle or my aunt. That is, even though it may seem to be a one-off illustration, they need the stories, they need the individual examples to understand it on a human level and to make them change their minds.
I love that. It's nothing, you're right, hearing the stories, which is one of the reasons why we wanted to do Wisdom Wednesdays, in order to increase awareness, to bring esteemed panelists as yourself so that we can increase awareness with the nurses with NBNA. But hearing personal testimony, I think really speaks more than anything. I love the comment in the chat box from Karen Rawls. Could you please speak to your comment, Karen? She's talking about the system. The system is set up for failure for those released. There are many twists and turns for the individuals. We have to also look at the use of probation requirements, which include money payment. Could you please speak to that comment, Ms. Karen Rawls?
Sure, I'll be happy to. I wanted to bring that up because I think that not only is it a difficult thing for those who are incarcerated to just come back into society after being in the horrific surroundings of being in a prison and in a survival mode for how many ever years that they're there. But not only do they come out to really a world that they've never seen before in many cases, some of them have been there long enough that they've not even had a cell phone. And then they come out and they have to navigate all the different things that are in the world that they have no knowledge of. And then also they're responsible for putting money back into the system. Money from where? They don't have a job. They don't have bus fare. They don't have support. It's just unbelievable, the requirements that are put on them when they come out, even in the halfway house. They have very, very stringent rules and requirements. They can't have family members in many cases to come visit them. It's just really difficult for them to be able to just come back into society just as a normal human being, let alone as someone who's been traumatized for who knows how many years in the housing of an incarcerated area. And just so you all know, I am in Georgia. Georgia has so many privately owned prisons, and they are all intermingled, I believe, in a lot of the political landscape of this state. And many Black people have family members that are incarcerated for reasons that you would not even believe, things that have been on the books since the 1800s. But when they come out, they go into these halfway houses, they have to have money, they have to have transportation, they are required to go look for jobs like every day. With what? They're not given any resources. So I would just wanted to bring that up because I think it's real important that we understand the whole picture, not only the political side, not only the part that we've been discussing in terms of recidivism, but why is it that we have such large rates of recidivism? It's not because they want necessarily to commit another crime, but it's as though they're being predisposed to do it so that they can survive.
Mm-hmm.
Thank you so much. Can I please have a comment from one of our or both of our panelists on her statement?
So I just want to say thank you so much for sharing that. And I think the way that you described it is fully accurate from the work that we've done and what we have heard. I think I just want to add to, important facts when we're talking about incarcerated women, particularly formerly incarcerated Black women. When we're talking about incarcerated women, we are also talking about survivors of sexual violence and trauma. And if you look at the data, depending on the study, it is anywhere from as high as 70% and higher of incarcerated women are survivors of sexual violence. And that includes intimate partner violence, that includes child sexual abuse, that includes rape, right? So people are not just traumatized when by the experience of being in prison, they are traumatized before they even enter. And so we need to support them in addressing the harms that they have experienced over the life course. And also those are things that are impacting their ability to stay in the community. You also mentioned jobs, and I just want to highlight for formerly incarcerated Black women, the Prison Policy Initiative has a report that I think is from 2015 that shows that formerly incarcerated Black women actually have the highest unemployment rate of any group of formerly incarcerated people. And I think the statistic is something like 47%. jobs are one of the #1 factors that keep people keep them from reincarceration, rearrest, recidivism. So we have to really be thinking about jobs for Black women, and we need to be thinking about how do we support them through healing through the trauma that they've experienced, because those are the ways that we can have direct effect on the incarceration of Black women and other women of color.
Okay, thank you so much. I want to change to another question. Well, Mr. Karoon, did you want to speak to that briefly before I go to
No,
this?
I was just going to agree with the description of reentry in its worst form. In Maryland, we have folks who are incarcerated hundreds of miles from where they lived and have any support network, and they're released there with $50 in prison garb and have no way to get home in effect. That is the worst case scenario. It is definitely setting people up for failure unless we have better connections and transitions.
Thank you, Miss Karen. Oh, wow. I have 2 incarcerated pen pals and 1 family member incarcerated. Building relationships with incarcerated people through pen pal programs or through connecting with relatives are great learning. And it's in the chat box. Also reaching out to different legislative initiatives. But I have a question. How does the era of mass incarceration differ from other episodes in history? For an example, the Jewish people in Germany, the Japanese in America, the Native Americans on reservations, etc. What do you guys think of that? How do you think the era of mass incarceration, and I think this is a good question to end it on, because one of the panelists says, my first question was, in the United States, of everywhere in the world, the United States, we have most people incarcerated than anywhere else. And I think we really covered that in detail. But think about it. How does the era of mass incarceration differ from other episodes in history? And I'm going to start with you, Mr. Phil Caron.
I am more of a mind that there are similarities between the kind of discrimination with African-American folks being arrested and incarcerated 2 to 3 times at least their percentage in the population. I'm just thinking in terms of Native Americans, the genocide that occurred there, and the gradual isolation of those folks into reservations, which themselves were then carved out and reduced further still. It is hard to say how that is different, except that African American and other minorities are not geographically isolated and pushed. Instead, they are in all parts of our country, and so the manner of their oppression, mistreatment is equally dispersed. I think so much crime is the result of economic disadvantages and social disadvantages, and those disadvantages and educational disadvantages have been imposed historically in a racial discriminatory way. It is, there is a connection of systemic racism, whether was intentional on the parts of all people or of leadership, and it is something that definitely needs to be reversed.
Thank you. All right, Dr. McKinley, same question.
So I'm not sure that I'm sure on what you're asking, but the thing that I see that connects the story of mass incarceration to the other examples is, to me, that mass incarceration is like modern day genocide in that way for the Black community, in that we are predominantly incarcerating Black people. And I think that that decision, whether it is a conscious one or not, is really a reflection of how much we value Black lives, how much we see Black people as worthy and deserving. And I think the mass incarceration that we see in this country signals that we don't value Black people, we don't value poor people. There are also disproportionate rates of Indigenous people who are incarcerated. And so I think that we have to, see this not just as punishing people for committing crimes, but that it has another aim. And I do think that is to destabilize our communities and to really continue to keep us in a position where it is much more difficult for us to access mobility and opportunity. We live in a world where Black men can expect almost that they're going to be incarcerated. There's data on that. And so that isn't a reality for other groups. And we have to recognize how that impacts our communities and our families. And to me, it is akin to genocide in that way. I mean, and I'm assuming that is the connection you're making given the examples.
Yes, I am, because it's a lifetime. All of the examples, the fact that both panelists, you both talked about African Americans, we're number one when it comes to being incarcerated, even all the way down to our children when it comes to plea bargains. And it is not something that just happens a one and done. It's something that happens, it transcends, and in so many levels, in so many different ways. So at this point, I would like to say thank you to both of our panelists for sharing this time with us today. I cannot believe how fast an hour went by with such robust information. And at this point, I want to turn it over to Dr. Broadnax to kind of summarize everything we discussed today. Dr. Broadnax.
Thank you, thank you, thank you. An hour is never enough. And I appreciate the expertise of the two panelists who shared their experience and recommendations to address the issues of mass incarceration. But my job right now is to summarize this lively discussion. And we have had a very lively discussion around what is the purpose of prison or imprisonment. Is it punishment or is it rehabilitation? And what are those factors contributing to the high rates of incarceration in the United States? Some of them are the mandatory minimum, the enhancements to sentencing, and plea bargaining, which is a new one we had not heard before, or even I had not even thought about. And there we discussed quite in depth about the lack of health care post release, and how there are those who have been recently released who choose to engage in low criminal activity because of a lack of the ability to access health care. Because while they were in prison, they did receive regular health care. They received medications, which we know are very expensive, as well as shelter. And it's not unheard of because it is a regular practice for those who really have chronic illnesses. And then we, to close out our discussion today, we compared mass incarceration of today with mass incarceration episodes throughout history. And are they similar or are they different? And the discussion continues. So thank you so much, Dr. McKinney and Mr. Kareem. and attendees for joining into our series of discussions on prisons and healthcare and the impact on our community.
So at this point, I hope you guys have been educated and informed. We've had 5 weeks of Wisdom Wednesdays, because when you talk about prison reform or mass incarceration, you just can't do that in one webinar, right? And so we decided to do it over a period of 5 webinars, and we have a population health tab with NBNA. Anyone can go and see all 5 webinars. The panelists will be sent all 5 webinars, and we just want to say thank you for being a part. Please, please, please fill out the evaluations to let us know if you received all of the information you need, or if there's something that we can do to improve. Please fill out the evaluation. And today, that concludes Wisdom Wednesdays. Thank you and have a great rest of your day, everybody. Bye-bye.
Thank you. Take care.
Bye.
Bye-bye.